While the COVID-19 pandemic is moving out of its most acute phase, its effects continue to challenge the healthcare system and healthcare workforce of Massachusetts. Healthcare workers provide care in many settings and make sure that patients get the care they need at each stage. Even before 2020, healthcare workers reported challenges such as high turnover and a lack of support. The strain of the pandemic has exacerbated these challenges and disrupted patient care. Limited staffing can mean that patients are unable to get care when they need it or may spend too long in the wrong setting of care. To understand the crisis facing the Massachusetts healthcare workforce, the HPC examined workers in nursing, direct care, and behavioral health occupations, and explored challenges at each stage of the workforce life cycle to understand how employers and the Commonwealth might begin to address them. Challenges for registered nurses in Massachusetts are concentrated around employment and retention, because difficult working conditions often contribute to turnover. The strain of providing care during the pandemic and the reliance on contract nurses for staffing have led to increasingly unstable work environments, leading some nurses to leave their current jobs or to retire from the workforce altogether, exacerbating challenges for remaining nurses, who may then leave themselves. By contrast, challenges for direct care workers span all stages of the workforce life cycle and are mostly related to wages. Training can be expensive, and workers receive low wages for high responsibility work, often with limited opportunities for advancement, which can lead to turnover and attrition. While Massachusetts has more nursing assistants and aides per capita than the U.S. as a whole, employment in these roles has fallen rapidly. Direct care workers may leave patient care for less stressful jobs with fast rising wages outside of healthcare, especially because the cost of living is high in Massachusetts, and housing, food, and other expenses often exceed what direct care workers earn. For behavioral healthcare workers, challenges are related to the high cost of training and the division of care provided in person and via telehealth. The HPC found the fastest employment growth in settings where care can be provided via telehealth, compared to slow or falling employment growth in more intensive or inpatient settings. Wages are a common reason for recruitment and retention challenges in behavioral healthcare work as well. Solutions to the current workforce crisis will be different for different kinds of workers and will require sustained investment from both employers and the Commonwealth. For nurses, employers should focus on retention, for example, with mentoring, increased administrative support, and schedule flexibility. For both direct care and behavioral healthcare workers, employers should focus on opportunities for professional development and advancement, and the Commonwealth should reduce barriers to entry with upfront funding for training, including for behavioral health roles that need advanced degrees. Full findings and recommendations are published on the HPC's website.